system. It's called the careware. The careware is the IT system. That means it's help all the employees, or also the patient. You can see it in the we have two type actually with the careware. One, they use it for nurses and all stuff like management, the normal one. Okay, it's like this one. We put don't block, then run. Okay, this one for the nurses. Sorry. The login ID, it's depend on the employee ID number. Okay, it's given by the HR. For example, my ID 1824. Here is the password. The first time we will put the password from 6 to 1. After that, when you log in, after that the computer he will say change your password. You will follow the step. It's coming in the right side. That means you will put the password as complex password. It's including numbers, including special letter, and okay. For you are using the as nurse. Here I don't have nurse. We can go directly to medical, hospital management, medical system, clinical modules, then nurse station. This the nurse, they are using this one, nurse setup, then nursing station. This one. This one you can see the file number for the patient. Here directly it's appear here in this blank area. It will appear the patient is related to the doctors. Okay, after that you can choose any one of them. You give them the medicine, the lab. You can order for them the lab, everything. Okay. Also, you can see the history for the patient. Here, the C note. If it's allowed for you to write the C notes, but it's related to the doctor. For example, I will show you here one file number. Sorry. I don't have the authority. I will use another one.
You can use mine.
No problem. See how it's come. If you want to search by specify patient, you can type here his ID, his file number. You press here. Okay. Then you can see if they have a previous lab from here. Here it's showing the 3 months. Only the lab is active for 3 months. If it's across the 3 months, for example, 5 months, 6 months, 8 months, we can go here. Sorry, if you not the current, the previous. Can see. If you press here, you can see all the details. Okay, it's easy. The system is easy. We can go to the next step. Okay. Now, okay. In the careware, if you face any issue, what is the step? Reboot the system. Read the error message carefully and try to understand the issue. If you couldn't, ask the IT department. Sometimes, as a nurse, if you open the patient name, you will find he doesn't pay. He doesn't make a consultation. He didn't make an appointment. Okay, that means he must to go the reception to pay or to get appointment. Then he back to you again. Regarding to the privilege, consider a part of a manager task, and he will be in contact with the IT department. Now you are in ophthalmology department.
Yes.
Okay, Dr. Mahmoud Ibrahim, he responsible for you. He will give you the authority. That means you are ophthalmology. If you change the department from ophthalmology, for example, to OBD, okay, ER, whatever, okay, that means a new privilege. Okay, also the privilege is related to the IT. If for example, if it's coming approved for you, after that the IT department, they will see your job description. Okay, if it's allowed to you to get this services, directly we will call you. Mr. Caesar, he will add you through the WhatsApp channel. If you have any issue, any question, you can type it through the WhatsApp. Also, we can receive the calls through 333, our extension number.
Okay.
Here, Windows login. That means it must to have every person except the people they are working as a shift time. For example, like ICU, ER, we create for them just one user, because the employee, they are changing between time to another. Okay, for you, if you have a stable clinic, that means you are related to one doctor, we will give you for that clinic one user. For example, ophthalmology, you have LASIK 1, LASIK 2, LASIK 3. Okay, and we create a password from 1, 2, 3, 4, 5, 6. I can't tell the password because okay. Sometimes we access to fix an issue with the computer. For example, here is the administrator. Sometimes you will find my name. How you can log in through other user. You type the doctor ID number, because we are working in the ID doctor ID doctors, because you are related to the doctors. Okay, you will write it, for example, 1, 2, 3, 4 is the ID, then the password. If we create it for first time from 6 to 1, maybe the doctor, he have his own password.
Okay.
You can ask. We have something, it's called JERA. JERA, actually, it's related to medical secretary. The medical secretary, anything you needed from the IT department, for example, email address, extension number, ATS code number, whatever, through the medical secretary, room number 104, okay? They will make a request for you. The request is electronic, systematic, it's electronic, we can receive it. Then the request is taken from 1 day to 3 days to work on this request, yes. We go to the BC. Now sometimes we are facing the BC it's not respond, the PC it's hang. What we can do in this step, just make a restart for the PC. When you make a restart, the restart it's solving the most of the issue. Okay, after that, if you come next day, you find your PC it's not turning on. First check the cable, check everything, it's connected to the wall, the electrical city, it's working fine, everything. If everything it's okay, that means maybe there's some issue, we will come and help you in that. Also the phone it's the main device. If the phone it's disconnected, okay, the computer it's will not connected with you, because the telephone it's have two board, linking board, one for wall, also one for the computer. This one, the second photo, that means your computer it's not connected to the phone. Check, because here sometime if we turn the PC, we'll find two lights here. Okay. That two lights, that means the computer is connected. Sometimes there is light, but the computer is not connected. Maybe it's related to technical issue from IT department. But this often it's happened. Okay. Actually, the main thing is the phone. If the phone is not connected in a proper way, it will not connect. You cannot use the PC. The internet is, in the hospital is restricted. We have a policy for that. It's not allowed for employee to open the news website, electronic website like Amazon or social media. It's banned. Also some medical website we close it. If anyone he need that, he make a request. The email ID we are using Microsoft 365. It's like Outlook and Hotmail. We have a format for that, for the email. The first name of the employee dot the last name of his family at elitehospital.com.sa. Anyone he can apply for it. Okay. Now the important thing is the downtime. Here most of the people they don't know how they deal with the downtime. What is the downtime? The downtime that means it's related to the period when the system it's not response. The main point is the system. When the system it's go down, okay, there is no services. After that, you will find a lot of how can I explain it? A lot of noise. That means what we can do. The system it's down. Help us like this. Okay, and in that way, what the employee should do? First thing, inform your head manager. Head manager directly will call the IT department. In that way, the third step, stop working, because you don't know when what is the issue. When the system it's go up again. Maybe it's taking 2 minutes, 3 minutes, 5 minutes. Maybe it's need a restart. The system it's need a restart. When it's restarted, it's take 5 minutes. That means you stop working. You can tell the patient, please wait for 5 minutes. After that, you can continue the work. Related to the IT department, we have 30 minutes to fix the issue. The IT department, they have 30 minutes to work in this issue and fix it. If it's across the 30 minutes, that means we will announce, okay, through WhatsApp, maybe through the phone. That means use another method, the normal method. That means yes. But this, it's rare, it's happened. Yes. When it's happened, if we have update, and the update in the midnight from, for example, 1 o'clock until 6 o'clock.
But most of the time they are announcing.
Yes.
It rarely happened that they have a downtime.
Okay. You can also see here, we have downtime folder. You can see it here, downtime. It's here. It's including the forms. The forms the employee he needed, for example, invoice, lab order, medical report, radiology order, also the registration. Also, this we have soft copy and hard copy.
Yeah. Per department.
Yes, for department you can see it like this. It's a paper. Okay, you fill it, then you fill it by the name of the patient and save it in a folder. For example, here the lab. Okay, if the doctor he need, for example, lab, you take the file number if you know it. Okay, maybe the phone number are registered in the hospital. Also, the patient name. You fill all the information here. The test code, you don't know what is the test code, but maybe you know the description of the code. For example, CBC. The result, it said the result, it's not coming because this result it's coming from lab. Okay, we can find it here in the downtime. Here one folder, it's called list. The list, it's including all the services are provided by the hospital.
But don't rely regarding the price because it may change according to insurance or cash.
Yes.
You will just follow the code.
The
For
code,
example,
it's
for
here.
CBC, it's the same thing. You will use the same thing if the patient is cash or insurance.
Yes. Here.
Except for Malat. They have another code. Malat.
Maybe. I am not sure about it. Here, if you find in this code in the system, okay, you will find its complete blood count, CBC with differential 168.